suffer from jaw pain, it's not necessarily indicating that you have a problem with your teeth. Now, we don't always think of going to a chiropractor when we're having difficulty chewing, but we treat all kinds of joints in the body, including the jaw. My name is Dr. Robin Armstrong. I'm a chiropractor at Willowbrook Chiropractic in Langley, and today I'm going to talk about the TMJ, or the temporomandibular joint. Now, how do you know if you should come and see us? Well, let me ask you a few questions to find out how well your jaw is functioning. Do you have any popping or clicking when you chew or when you open your jaw? If you do, that tells us that the little disc that's inside the jaw joint is sometimes getting snagged when you open or close. That's something that we can help you with. What about tension headaches that come from the temples on both sides? Sometimes that can indicate a clenching of those chewing muscles and they're overworking and too tense. How far can you open your mouth? Can you open it 2 fingers wide? Or 3? Or 4? So 3 fingers is the optimal amount. If you're only able to open it just 2 fingers, or you're able to open it 4 fingers, both of those indicate that there's a muscle either holding it too closed or too open. Now this next one you can check either by looking in a mirror or have a friend watch you while you open your mouth. As you're opening your mouth, does it open smoothly and go in a direct line, or does it go off to an angle or kind of zigzag as you open or close? That tells us that if it is zigzagging or going to an angle, then a muscle on one side is pulling you in the opposite direction more than the other side. So there's not symmetry into how the muscles are moving, and one of them is too tense. So if you were to come see us for any of these problems, how we would work on your jaw is we'd be pressing and putting pressure on these muscles either around the temple, around the jaw, near the chin, and we would have you open and close, maybe move the jaw side to side, trying to break down the tension in those muscles. I also like to use the activator tool. So this gives just like a single click. And if I notice that one side of the jaw is opening more than the other or not enough, then I might use the activator to ensure that the jaw is gliding open smoothly. What can you do at home before you come to see us? Well, you can stop chewing gum. That just overworks the chewing muscles too much. If you've been prescribed a mouth guard for night, you can start wearing that again. That protects the teeth from any grinding, and then it also gives the muscles a bit of a break. And then you can start to notice when you're chewing, do you tend to chew only on one side or the other? Try and chew evenly on both sides. Now, of course, if you can't because it's painful, well, then that's another sign that maybe you should come see us and we can check out your jaw. We post lots of different content on YouTube under Willowbrook Chiropractic. If you have any questions about what I've talked about here today, please feel free to ask myself, Dr. Robin Armstrong, or Dr. Jody Freedman. We're always happy to help.